You're listening to Oprah Radio.
The Derrick Ashong Experience. A mashup of politics, pop culture, and what people are talking about. Here's Derrick Ashong.
That's right, folks. This is Derrick Ashong. You are listening live to the Derrick Ashong Experience on Oprah Radio, Sirius 195, XM 156. We also live online at ustream.tv/Derrick Ashong Experience, Facebook.com/Derrick Ashong Experience, Twitter.com/Ashong. We are talking about healthcare. And personally, I've been listening to all of this debate, and it seems to be that there's a fundamental discrepancy in how people see the issue, particularly the different political parties. And I heard Mary Madeline on CNN the other day put it into the most simple of terms. She said that the Democrats believe that healthcare is a right and that Republicans believe that healthcare is a responsibility. I was shocked that she actually put it in those direct terms, that Democrats believe healthcare is a right and Republicans believe healthcare is a responsibility. I think that that is actually heinous on the part of the Republican Party to make a statement that way. And I got to guess some of y'all calling me, some of my listeners I know are in the GOP. You got to let me know if you really buy into that, because it does not resonate with me. We just spoke to Amy. Her husband got injured and he needed to somehow, he needed to have surgery in order to continue to work, to take care of his family. And they got the surgery that was required, not that they got a nose job or some Botox or he got a little tummy tuck. He had back surgery so he could walk. And now they get stuck with a bill for $8,000. Now, I don't know how much money you guys make. Y'all listeners may be, very, very pricey in your lifestyles. $8,000 may be no thing but a chicken wing to you. But imagine that you made $40,000 or $50,000 or $60,000 a year, right? If you make $50,000 a year, $8,000 is a big chunk of your income. That's almost 10% of your income on one surgery. And someone is going to say, well, that's your responsibility. But here's the issue. I love it when we say you've got a responsibility to work hard. You got a responsibility to try to provide for yourself, to try to provide for your family. I can dig that. I get it that everybody should get up, get out, and try to get theirs. But what happens when you get hurt and you can't? Are we really willing to say, well, screw you, sorry it happened, but that's too bad. You're not rich, well, you're not going to get the care you deserve. Or you're not rich, well, we may have to bankrupt you. Is that really correct? Healthcare is unequivocally a right if we want to claim to be a moral society and a society that is advanced enough in its thinking that other people should look to us for guidance. We say that America is the best in the world. We are the greatest democracy. We cannot be the greatest democracy on the planet if healthcare is perceived to be a responsibility, because most of us can't help if we get sick. And when we do, we need to be willing to look out for each other, because you never know when it may happen to you. I got Cheryl on the line, and I want the rest of you to join us in a moment. 866-OPRA-XM, 866-677-2496. Do you have a positive or a negative experience with healthcare? Cheryl, how's your experience been?
Well, Derrick, this hits home for me. My father got sick at 58, had never been to the doctor. I'm a pastor's kid. We didn't have money for insurance, so he didn't have insurance. And I walked in with the nurses just pushing my father around. He couldn't even walk. And they knew he didn't have insurance. They sent him home, and my father died. When my father passed away, it left my mother with over $100,000 in insurance bills. And I remember looking at the report with the ambulance when they brought him home. The report said he wasn't supposed to have any food, but in the pockets, and I have this on videotape of my father's mouth, was nothing but food in his pockets. But on his report and stuff, it said he could only have liquids. And I remember saying, somebody's going to pay for this. I personally, I'm only 41 years old. I had a stroke this past year. It was $610. I live 5 miles from the hospital. I don't have insurance. My husband and I were self-employed. My husband has diabetes. It's not that we can't even get insurance. It's not that we can't even afford. We can't afford to get it. They won't even give. I can't.
Because of your
pre-existing
condition.
They won't give my husband insurance because of pre-existing conditions. And they
Gotcha.
took me to the hospital with my stroke. It was $610 for them to drive me 4 miles. That's
So-
just what the ambulance cost was alone.
Now, Cheryl.
$610 for 4 miles.
Now, Cheryl, so now this is heavy. I mean, these are a couple of very major issues, and I want to separate them a little bit so that people understand what's at stake here. First, I want to talk about you and your husband. You guys are working, both of you self-employed. I'm assuming you must work pretty hard. Do you have a family?
Of course, I have two sons. They're
Okay.
20 and 22 years old, and we work extremely hard
20
trying
and
to
22
just make
years old.
a living.
So
you know?
you've raised
Yeah.
your children to adulthood, and your husband is diabetic.
Correct.
And because of that, you
Right.
can't even get insurance, even though you can afford it. People won't give it to you, right? Because the assumption, once again, because there's a lot of people listening who don't understand what this idea of pre-existing condition is. Basically, the insurance companies don't want to take the risk of having to pay out money. They make their money by taking in as many dollars as possible and paying out as few dollars as possible, and that's how they get their profit margin. So in your case, because your husband is diabetic, they're thinking, oh my God, diabetes, he could have all kinds of illnesses and ailments. We're not going to give him insurance because we may have to actually pay for health care. That pretty much sums it up. And so you find yourself in this situation where you have to pay just to get in an ambulance to go a few miles down the road, correct?
$610 for 4 miles was just what the ambulance bill is. I've been getting so many bills coming through that I won't even open up the mail now, Derrick. And it's not that I'm not a responsible citizen.
Yeah.
You know, I was a Republican. I switched over to Democrat. But it doesn't matter to me what party it is. I think every citizen, whether Republican or Democrat, deserves the right to health care. And that was my main issue.
I agree
even
with
with
you
this last election.
wholeheartedly. Every citizen, Republican or Democrat, independent, green, whatever, deserves the right to health care. Now, I want to talk briefly about what happened with your father, because that is really like a powerful message. And again, I want to make sure that people are understanding this. Sometimes the arguments get twisted, and it's like, oh, these irresponsible folks have not taken care of themselves, and they're now leeching upon the community because they don't have care. Your daddy was a pastor. That meant that he dedicated his whole life to serving the community. I find it really interesting right now that the Republican Party, of which you were a part, the party that is supposed to be about family values, is fighting against healthcare reform when there's nothing that touches families more than the life or lack thereof of their family members. When your father died, how did your mother deal with that $100,000 worth of medical bills?
I live across the street from my mom. She's still dealing with this. The people will call her, and she says, my husband is deceased. I have a small church. Well, what are you going to do? And the attorneys are telling her, file for bankruptcy, you know. And she's like, I shouldn't have to file for bankruptcy. The man got sick. He died, you know. And when the collectors call, they have no... they don't care about he died.
Yeah.
That's not even an issue.
They just want the
how
money.
and when are you going to pay this $100? Exactly. And when you go into a hospital, it's clear how they treat you. If they see you have insurance versus they don't.
Yeah.
There should be some hidden cameras around, because this goes deeper than just having health care. It's how do they treat you without health care.
Honestly, Cheryl,
and it's sad because I watched this noble man.
That idea of that dignity of how they treat you, that is huge. My mother is a nurse. And my father is a pediatrician. They both have worked in the medical field my entire life. My parents have told me that they see the way, and I mean, they are not this way in part because, you know, they both grew up in another country where people didn't necessarily have health insurance. They got into medicine to really try to save lives. But my dad has told me, he's like, look, I've seen how people treat patients when they come in and they find out that they don't have care. And it's like there's some other kind of creature. It's almost like your humanity is stripped away from you because you don't have the ability to pay. I want to ask you, Cheryl, we've got a few other people I want to bring into the dialogue, but before I let you go, what do you want to see happen? What would you like to change?
I would like to see every person living in the country they call the United States of America, they have the option to say, yes, I want insurance. And whether you have to do it based on what income they have coming in, they deserve to have the excellent excellent care that the millionaire has versus what the person that's not making any money have. Because my mom right now, she is battling. She's had strokes. And guess what, Derrick? I'm going through it a second time with my mom, taking her back and forth to the hospital and the type of care that she's getting. And it's sad that you would have to go through this, but I'm going through it twice, and nobody should have to go through it. Well, we are responsible people.
Cheryl, I want to really thank you for calling and for sharing your perspective. And I'm sending my own personal prayers to you and your family and to your mother that she will be okay. You guys are clearly giving a lot to the community, and you deserve to have the basic respect of having a chance at health. You know, everyone gets older. Everyone gets sicker. It is the nature of life. If you are born, someday you must pass. And it breaks my heart to hear the story of your family that is struggling day to day with this issue when your whole life's mission has been to help other people. So I want to thank you for sharing that with us. And I'm hoping that we can actually get some reform passed so that families like yours will not have to deal with these kinds of issues. Folks, this is big, and this is personal. Every time we turn on the television, I hear people talking about the policy, how we're going to deal with it. Are we going to go to reconciliation? Is there going to be bipartisanship? Are the Republicans and the Democrats going to hold hands and walk down the aisle? I couldn't care less if they're willing to hold hands. I don't care if they golf together. I don't care if they like each other. I don't care if they respect one another. I care if people like Cheryl are going to have the chance to live in a society that values their lives. You want to talk about a pro-life movement? Then let's be pro-life. All life. I want to hear your thoughts. We are talking about the healthcare situation in the United States. Do you have health insurance? Do you have health care? What have been your experiences? Positive, negative. Do you think we've got the best care in the planet? That's what I heard them say during the summit, right? John Boehner, the minority leader in the House of Representatives, said that we have the best health care on the planet. Do you believe that? Do you have the best health care on the planet? I want to hear from you directly. 866-OPRA-XM, 866-677-2496. Renee, do you have the best health care on the planet?
I have good health care. I think America has the best health care in the world.
Okay.
I'm self-employed, and I pay $250 a month for my health insurance.
Okay.
I make $30,000 a year. So I'm real worried about the way the Democrats are going about health care reform. I don't think they're going about it the right way. I'm very worried that I'm not going to be able to afford health insurance the way that things are going.
Well, so this is a great point, Renee, and I want to hear from you more into this because I've been talking to a lot of people about the reform itself. What is it about the way they're going about it that makes you feel like your premiums might go up?
Well, I don't like the fact that I can't go across state lines and buy health insurance. I don't like the fact that they're not taking into consideration, doctors being able to be sued and the amount of money that they get for being sued. I'm very worried about that. And my fiance, he is on disability. He cannot work, and if something happened, he's on medical retirement. If something happened to his insurance at his employment, he may have. I think he has one of these Cadillac plans that they're talking about.
Yeah.
He does have the best health care in the world.
Okay.
And if something happened to that, this is a man who is going every few weeks to have injections in his spine to kill some of the nerves in his spine. He's in so much pain.
Wow, that's heavy.
He has Medicare.
He has Medicare. Okay, so this is interesting because a couple of thoughts. I think that you raised some really good points in the debate, right? State lines. Should the people be able to buy insurance across state lines? Now, what I've seen in the current proposal is that they're going to have medical exchanges where you can have insurance. People who don't have insurance right now can actually come in as a collective pool, let's say small businesses, and they can select insurance that they can pay for, and they'll get a cheaper rate because it'll be a group buy. You know, it won't just be like me as an individual. The state lines thing is big, but I think there's a little bit of nuance that hasn't been fleshed out yet, right? So I agree with you that people should be able to buy across state lines. However, the point of people being able to buy across state lines is so that they'll get the best deal. If you have companies that are able to say, well, I'm going to be located in state X, right? Let's say that, for example, Nevada says, you know what, we're not going to regulate the health insurance industry. And I live in Iowa, and Iowa is like, yo, we're going to have major regulations, make sure insurance companies cannot overcharge you. And Nevada's like, no, we don't care. What will happen is Nevada companies will go to Nevada, offer cheap care, or at least the appearance of cheap care that doesn't really give you the right benefits, and force a competitive pressure on the other companies across the country to also go down into that cheap care with lower benefits. So one of the things that I think must be addressed if we go to have insurance across state lines is you've got to have some sort of national minimum standard, right? Otherwise, someone could say, hey, man, I've got great care. And if you go to buy it from them and you don't realize that even where do you live, actually, Renee?
I live in Alabama, and when I shopped around, when I first started shopping around for my own health insurance, I got quotes from $600, you know, to the $250 that I'm paying a month.
Yeah.
And, you know, you have to find out what the lifetime cap is. You have to know. I mean, it was a big education. I'd always worked for a company where it was provided.
Well, Renee,
but you have to find out what the maximum amount that you have to pay out for a year
Renee,
is. You know,
you have to do your research. I definitely hear you. But the fact of the matter is, like, you know, most people do not have a private attorney that can read the fine print for them. And what we saw in the credit card industry is that people would sign up for a credit card, would have a basic understanding of what they were getting into, and then would find that their rates were being jacked up, etc., because the companies didn't have any sort of national minimum standards on how they could and could not treat consumers. Now, I agree that people should understand what they're getting into, but you know what we learned from the financial industry? When things broke down, you come to find out that the investment bankers, the people who spend 24/7 and make $1 million or more a year working on this, didn't understand the industry. And I suspect that healthcare is even more complicated than credit cards and finance. So I feel you in that we should have people be able to shop for their own insurance 100%. I think that we have got to have a baseline of what is expected so that people can't screw you and I over. I think that's important. I want to go to somebody from Twitter who is making a point. Must Love Dogs 3 says, luckily I have health insurance through my employer, but the premiums and copays continue to rise and preferred providers are limited, right? We're also getting a question from Madison99, who I'm going to come back to later on. Madison99 is coming to us from Ustream, and she says in Sweden their taxes are 50%, and everyone has health care. Everyone is taken care of. I think that is great. Madison99, I know you are Canadian. I don't know if Americans are willing to go for taxes of 50%, but that's not what's on the table right here. Now, Madison99 is also asking, what exactly is Medicare and what does it cover? I'm going to tell you really quickly. Medicare is basically a government-run program where people, once they reach above the age of, I believe, 65, they are able to get what is called single-payer health care. The government pays for their medical expenses. There are different facets of Medicare where you can pay for additional service, but the core of Medicare was designed to make it so that when you become elderly in the United States, you wouldn't just be old and sick and can't afford to get care. So when Renee tells us that her fiance is on disability and he gets Medicare, that means that in addition to whatever plan he already has, he's got benefits that are guaranteed by the government. And it's a big deal because Medicare is a crucial part of our social safety net, but it's also not structured in a way that's sustainable. So it's got to be fixed, and we have to be thinking about how to do that. That's part of what's at stake in this healthcare reform bill. I want to hear from you guys. Have you been paying attention to the debate? Do you believe in the healthcare reform bill that's out there right now? Do you even understand it? I want to know, what's your experience with healthcare in America? Rachel, you are on the air.
Hi, Derrick. Thanks for taking my call.
Thank you for calling.
I wanted to comment. I'm kind of torn. I listen to callers like Cheryl, and it's a very personal issue. But what I struggle with is, for me, it is a matter of economics.
Yes.
And as you discussed, ensuring and covering every American, the money to cover everybody comes from somewhere. And if it becomes a government-run program, it leans more and more towards a socialistic society. And I don't disagree that basic health care should be available to everybody, but it cannot, in my opinion, be something that the government funds entirely while we still have capitalism in play and insurance companies who are able to collect rates and make $5 billion a year in profit, like Blue Cross.
So, Rachel, I have a question for you. When you are talking about the government not paying, what is your impression of the current proposal that's on the table? Do you believe that that represents socialized medicine, or do you believe that that reinforces the private sector?
I believe it reinforces the private sector. I think if they keep public insurance companies, I happen to be a Blue Cross.
Okay.
Blue Cross, I'm covered by Blue Cross, so I know a little bit about their company. But when you keep a public company like Blue Cross on the table who's going to cover Americans, and they're making $5 billion a year.
Yeah.
Last year they made $4.5 billion a year.
Yeah.
We are upside down on healthcare costs in the United States.
Yes.
The government is paying through Medicare and other Medicaid, other programs.
Yeah.
And yet we've also got this public sector that's making a lot of money. I think if they really want to have a comprehensive healthcare reform and overhaul, politicians need to be willing to say, we're going to lose some friends in big business, and they need to be willing to cut insurance companies off.
Okay, thank you,
because
Rachel.
Somebody's making money off of Cheryl's parents.
You are absolutely right. And I'll tell you, Rachel, this is what makes it a complicated issue, because you made two very strong statements that I think are kind of spot on. On the one hand, you've said that everyone should have a right to health care. At the same time, you're worried about the cost, and you don't think we should move to a socialized system where the government takes on the entire cost of health care. I very much agree with you on that point. I think that, for one thing, when people talk about like having health care where the government covers everything, very few of them are talking about a nation as big as ours. I mean, this is a country which has got 300 plus million people. And those people are coming from all kinds of walks of life and all kinds of different experiences. And it's complicated to have care that is nuanced enough to work for what you need if it's all going to be run through a singular bureaucracy. Now, what's happened in this particular debate is the issue has become confused, because you've made another excellent point that, the companies are making a ton of money off of this healthcare, and we've got to make sure that they're not just ripping the people off. Well, this is the difficult reality that we need to deal with. If we're not willing to go to a single payer system where the government runs the whole thing, which I don't think we should do personally, and I don't think so because I think that it is not the most efficient or effective way to go. It doesn't have to be apples and oranges. We can find a happy medium. If we're not willing to have the government be the single payer for healthcare, that means that private entities have got to be involved. If private entities are involved, it means that they're going to be trying to make a profit unless they're nonprofit organizations. So The issue right now is how do we strike a balance between having adequate health care that everyone can get access to, preventing people from manipulating the system, preventing them from not covering you if you've got a pre-existing condition, preventing insurance companies from kicking you off if you get sick. You've been paying for 20 years, 30 years, your monthly premium. You get ill and they're like, yeah, we're not going to cover that. Or worse yet, the company will say, well, we'll cover part of it. But if you're really sick, we put a cap on it. If you're really sick, we just got to let you go. 30 years worth of insurance that you've paid for, and yet and still you can't get the care that you invested in. That's just the people who are already buying healthcare. That's not even counting the folks who don't have it. And what's at stake right now in this country is big. We're talking about how do we reform this system such that we all have a chance to literally live. How do we create a pro-life movement that encompasses everyone? It's not just rhetoric. It's not just speaking about the unborn. It is actually speaking to the lives of those who live next door to us, the lives of the people we live with, the lives of the people we love, and the lives of the folks we don't know. Because someday the person in need might be you. And the issue at stake, or what we should understand, is that all of the proposals that have been put together, none of them has been on the extreme. There is no proposal on the table right now for socialized medicine where the government takes over the healthcare system. And there is no proposal on the table right now where the government just lets it rain and the insurance companies can do what they will. What is on the table is a reform of the existing system so that we can protect consumers against being taken advantage of by insurance companies. That is not socialized medicine. That is justice. That is democratic society where the leaders we elect make sure that multi-billionaire corporations cannot take advantage of us. This is important stuff, and we've got some more thoughts on it. We got a ton of people calling, a bunch of people commenting online. We're going to take a quick break, and when we come back, I want to talk specifically about the health care bill in Congress. You listen to the Derrick Ashong Experience. We'll be right back.
Ain't no love in the heart of time. Ain't no love.
This is Oprah Radio.
You're listening to the Derrick Ashong Experience. Here is Derrick Ashong.
Hey, you guys, for those just joining us, we are talking health care. This is a big issue. It is the issue of the day. And it's something that people are talking about nationwide, and we need to get really serious about what is going to happen on this issue in order to make sure that our people are able to actually live and thrive in this country. Now, one of the big things that's been going on is there's been this whole argument about the partisan divide. The partisan divide. Republicans think this thing, the Democrats think this. And coming out of the healthcare summit on Thursday, where President Obama invited leaders from the House of Representatives and the Senate from both parties to come to the White House, to Blair House, which is near the White House, but basically to come together and discuss this issue. The commentators on the news were really talking about, well, it was a bitter conversation. There was, real division. Now, I listened to this conversation and I thought that there was a lot of agreement and a lot of very interesting ideas raised on both sides of the aisle. I remember hearing specifically Senator Tom Coburn, who is a Republican, raised some very, very important points about how you refine this model of care. Senator Mike Enzi, who's also a Republican, raised some very powerful points around how you go about the creation of bipartisan legislation. Now, Mike Enzi did not tell people that he was part of the gang of six that was working on that bipartisan legislation, which I think he should have let them know. But at the same time, he also made the excellent point that the Republicans didn't want there to come a proposal already half made. They wanted to be able to co-sponsor and build something from scratch. Now, as you've heard on the show, we listen to everybody. This is not your typical talk radio where somebody comes in there with their preconceived ideological notion and I only want to hear from people who agree with me. I personally am very, very confident in my beliefs and my ability to articulate them. What I'm more interested in is not having you call to reinforce what I think I know, but having you join in a dialogue that is helping to move us all forward towards some kind of understanding of what's really, really going on. And this is a big deal. I want to talk to a couple of people, and we're gonna get into this partisan issue a little bit, and I want to talk a little bit more about the policy. You guys should be a part of this conversation. Do you have care? Is it any good? What do you think about the proposals that are currently on the table? 866 Oprah XM. 866-677-2496. Julie, you are on the air. I understand you disagree with me.
Well, I basically just have a question, and thank you for taking my call. I'm just wondering, first of all, can we agree that we're not really talking about a health care issue, we're talking about an insurance issue? And also, I'm wondering why a government-run program would be bad, and I'm wondering if it might be a good idea to sit down with all the other countries who have government-run programs and take what's good from their program and see if I mean, I don't know. I have no idea. I'm just asking. Why is that not a good thing?
Julie, this is a great question. I'll tell you, well, two things. One, I don't think we're just talking about an insurance issue. We actually are talking about a health care issue. And the reason we're talking about that is that the United States, so people say we've got the best health care in the world. We don't, frankly. And the reason we don't is because we have higher costs for lower results than most developed countries, right? We've got high costs, the most expensive healthcare on the planet, but our outcomes are not comparable to other developed countries. So we can't say we've got the best care. Now, what we do have, if you have the money, you can get access to the best technology and the best physicians in the world. But I don't think that equates to having the best care. That's like saying that you live in a community where half of the population is destitute, unemployed. And then another 20% live in ramshackle buildings that nobody can deal with and nobody can really find a way to fix. And then you've got another 20% that are kind of living okay. It's kind of so, but not really having good education and good access. And then you've got 10% of the people are just living lovely, just gorgeous big houses. And you say that we've got the best housing and the best economy in the country because 10% of the people have no problems when 90% of them are screwed. That's basically what's happening with healthcare in the U.S. And forgive my numbers because I don't know if it's 90%, 10%, whatever. But what we do know is that a majority of Americans are either have seen their premiums go up or have lost coverage over the last decade. So first, I think it is a matter of care, not just insurance. What happens when people go into the healthcare system is some of them wind up getting treatments that are not necessarily helping their condition, but that are raising prices. And because of the practice of defensive medicine, which one of our callers brought up the issue of doctors being sued, that's a big issue. We've got to find some way to address tort reform, or you're going to have people continuing to practice defensive medicine, which just means not let me do what's best for you, the patient. Let me do what's best for me, the doctor, to make sure I don't get sued, right? So it's more than just insurance. Insurance is big, though. Now, Julie, you raise a really, really great question of why not have government-run healthcare? Why not have a holistic single-payer system? I have a few thoughts. For one, we wind up starting the discussion from a position of we will have this or we will have, we'll have government-run healthcare or we'll have no government involvement. But you, Julie, are right on point. You're saying why not look at other countries and what they've got and do a comparison? If you look at Switzerland, for example, they've got a healthcare system that's hybrid. The government is involved, but it's involved in regulating private entities. I believe those private entities are required to be nonprofits, which doesn't mean that they don't make money, but it does mean that they have to reinvest that money into the company. And don't quote me on that. We can look it up and see. But they do have a hybrid model there. I think that it is eminently possible for us to have a hybrid model here, where you have insurance companies that compete and innovate in how to provide the best quality of care. The problem is, right now we've got a monopoly in the insurance industry, right? Insurance is one of the few businesses in the U.S. that is exempt from antitrust laws, which basically means that you've had collusion among the insurance companies, the health insurance companies, to get together and raise prices or manage their care in such a way that you won't have effective competition where somebody undercuts the rest. Additionally, in some states, because you don't have the ability to go across to other states, across state lines to find good proposals, you have some states where there's only one or two really viable options. If we want to look at a way to reform the healthcare system, I think it's eminently useful to see what other people are doing. Now, that has been happening with the proposals that are currently on the table. And the reason why I personally don't believe in a single payer system is because our government has already created some significant entitlement programs, Social Security, Medicare, Medicaid, that are now a fundamental part of the fabric of our society and which I believe we should keep, but which we already have to reform, and we haven't seen the political leadership willing to do that. Right now, as it stands, we need to cut spending and raise taxes in order to address our deficit issues. Doesn't mean we have to do it today. In the midst of a crisis, you got to continue spending and you cannot raise taxes. But the recession will come to an end. Will our leaders have the courage to tell us taxes are going up, spending is going down? Are they just going to tell you what they want to hear, right? If we're in that situation right now where we haven't had the political courage to do what needs to be done, how do we then move to adding a new significant entitlement program where we haven't learned to pay for what we already have? Now, Republicans will argue that that is their bottom line on this issue, but it's a false argument, because one of the things that has to be done in order to reform our healthcare system is to fix Medicare. And the current proposal that is on the table in the Senate does that. And it saves an estimated, I think, $100 billion in the first 10 years and more in the second 10 years. We need to be looking at those solutions and seeing how they address the issue, rather than saying, let's scrap it and start from the beginning. We had 8 years of a GOP presidency. Most of that time, there was also a Republican Congress. And what did they do to reform the healthcare system? They passed Medicare Advantage program, which now has the government paying private insurance companies above market rate for the healthcare. So they basically upped spending and did nothing to address the deficit issue that they claim to care about so much today. We need honesty from our politicians. We're going to be flipping the script coming up. This is a big deal, and I'm glad that we had a chance to talk about it. We're going to cover a couple of other issues because we don't want to stay focused on just one thing, but this is going to be an ongoing conversation. We're going to keep talking about healthcare until we get some legislation passed. But in the meantime, we're going to take a quick break. Before we do, I want you guys to all know that this is something worth paying attention to. It's critical for all of us, and I want to hear from you. If you think it's important, we're going to keep talking about it every week until we see a solution. You listen to the Derrick Ashong Experience. This is your experience. Want to hear from you. We'll be right back.
You're listening to Oprah Radio.
Please stand by.
You are listening to the Derrick Ashong Experience.
Hey, y'all. This is the Derrick Ashong Experience. Thank you for rejoining us. You can catch us on the air, Sirius 195, XM 156, and online, facebook.com/Derrick Ashong Experience, ustream.tv/Derrick Ashong Experience. And, of course, you can Twitter me at twitter.com/Ashong. The hashtag for this conversation is hash. It's what some of you call a pound sign or a number sign. Hash the DNAX. Join the convo. Now, we are going to flip the script just a little bit and talk about something that has been buzzing around the internet called chat roulette. Chat roulette is basically a tool, a technology that enables you to jump up online, turn on your webcam, and chat with someone somewhere in the world. You don't know this person don't know you, but y'all can conversate. Now, it's also a little bit controversial because a lot of people have been using it for less than pleasant purposes. So sadly, when you go on chat roulette, and I'm saying this for all you parents out there, before you go tell your kids, like, what's chat roulette? Could you guys check out chat roulette and tell us what it's about? I'm going to warn you parents. I'm going to let you know that there's a lot of naked dudes on chat roulette. And it's funny because I'm sure all those naked dudes are thinking, oh man, if I get out there and I just show my hairy chest, some young lady's gonna love me and she's gonna want to talk a little more and maybe she's gonna show hers. I don't think so, dog. I don't know. I don't know. Maybe it's just me. Maybe it's just the girls that I know, or at least what they tell me. But most of the girls I know don't go online with the interest of showing their naked bodies to random strangers. However, guys have got this in their head that this is what's really good. So I think the premise of chat roulette, that you can go online and talk to anyone, anywhere on the planet, just meet somebody and learn about their culture, is amazing. The thing was founded by a young boy, I think a teenager, like 17-year-old Russian kid. And this is what he had to say about why he founded chat roulette.
I do it because I like to chat with people around the world, to get to know other cultures, to see what people are doing in all over the world. And I have always had friends from other countries who I have been chatting to with internet. And I thought it would be great to make a service which will connect the whole world with each other. And people will get to know other countries.
A culture, a service that would connect the whole world to each other, right? I love that. You know, I am so with that. I mean, think about it. How often do you get to travel overseas? How often do you even get to travel cross country, right? We talk about the divide between nations. I'm talking about the divide between people in Oregon and people in Alabama. It's like different worlds, and we're lucky that we live in a nation that is so big and so vibrant and so culturally fluid and diverse that we actually can discover so much just within the nation. But imagine expanding that to the whole world. You know, I could talk to somebody in Thailand. I could talk to somebody in Tibet. I could talk to somebody in Tanzania. I could talk to somebody in Costa Rica. I could just get online and find someone in the world and chat about what's really good in our lives and what's happening. And I love the premise. I think it's so fun and so exciting. However, do I really want to see some naked dude doing things that I would not like him to do to me when I get online, right? Because unfortunately, this is what seems to be happening most of the time on chat roulette. Well, we want to know a little bit more about this issue. So we talked to a young man who actually had a lot to say about it. He made a video about chat roulette that is online, and it gave some people some great insights. And I see folks have, I tweeted it out earlier this morning, and a bunch of people have been repeating it. And basically, he gives us an idea of his experience on chat roulette and experience of a friend who is a little bit different from him. And Casey, thank you so much for joining us. How you doing?
I'm doing well. How are you?
I am great. How have people been responding to the video?
You know, it's been overwhelmingly positive. I think it's at like about 250,000 views on Vimeo, and people are pretty stoked for it.
So now for the listeners, most of them haven't heard about this. So could you give us a brief summation of what chat roulette is to you and why you decided to make this video?
Yeah, you know, I was just listening, Derrick, to your explanation of what chat roulette was, and I think you did a pretty good job.
Thanks.
But I don't think you articulated just how random chat roulette is, which is I think the roulette part of the chat, because you can connect with anybody around the world, but you have no control
over who
you're
are.
Going to see, who you're going to. Yeah, you have no idea what you're getting yourself into. All there is one big button that says next, and every time you click that button, you're talking to somebody new. And just like you said, Derrick, you're talking to somebody in Tanzania in 1 second, you click it again, and it's somebody in Alabama. And I think the thing that turned me on the most about it, the thing that I thought was the most exciting, was just how random it is. And listening to that 17-year-old Russian kid who started it, it's clear that he started it with real altruistic ambitions, you know, to connect people from around the world. And that's definitely what excites me about it, is just the positives, what it could or should be is you could talk to or meet anybody from around the world at any given second. You have no idea who it's going to be. But I do think, Derek, that's also its biggest downfall. The fact that there's no accountability and you never know who you're going to meet.
And anyone could do anything.
That's what'll keep it from being great.
So that's an interesting point. And I know that, you broke down in your video, which I really loved, by the way. It was so funny. You broke down.
Thanks a lot. Appreciate it.
No worries. You broke down the percentage of the people that you were meeting. So could you just tell us what percentage? You had it in 3 categories. Is that right?
Yeah, let me break it down for you. So I literally had my notebook open, 3 categories and a pen, and I was doing line, hash mark. For every person I saw, just hammering on that next button. And the 3 categories that I determined were boys, girls, and perverts.
Okay, boys, girls, and perverts.
Right. Everybody knows what a boy is. Everybody knows what a girl is. And just like you struggle to explain what the perverts on chat roulette are, I also struggle for it.
Yeah.
But I advise not going on chat roulette to find out. Just perverts are guys doing things on there that nobody has any business doing in public, let alone on an internet site where you're going to run into strangers.
And that's why we gave the disclaimer to the parents: do not send your kids to investigate on your behalf. Okay, you are not going to be happy about that. So, what was the proportion, Casey, of guys to girls and to perverts?
I mean, I hope I don't misquote my own data in my own movie, but it's something
we'll
like
forgive you.
70% boys, 15% girls, and 15 or 14% perverts, something like that.
Gotcha.
But it's interesting. The vast majority are just kind of young guys, and there are some girls on there, and then there are almost as many kind of naked men on there doing God knows what as there are girls on there.
So what you're telling me is, if you go on chat roulette right now, you are most likely to just run into like a regular guy, just who wants to talk. Maybe you don't want to talk to you, but he wants to talk to somebody. Then the next likelihood is it's just as likely that you will meet a girl on chat roulette as you will meet a naked guy. Am I correct?
You're correct in every part except for one, Derek. You keep using the word meet, and I think the word see is more accurate because
they're next
to meet somebody. They have to choose to talk to you, because that was the other statistic in the movie, is just how quickly people decide to next you. Just one quick glance at your face, if you're not whatever they have in mind, boom, you're gone. And you never see them again. You have no idea who they were or where they came from.
And for the listeners, right, so this is another funny part of the whole thing. So there's that big next button that Casey has mentioned a few times. And basically what happens is folks will go on there, they'll look, and they'll say, do I think you look interesting or worth talking to? And they'll click next. Maybe you'll do the same thing to them. So there's got to be that certain element. I mean, it's bad enough when you're out at the club and, you see somebody, you want to talk to them, you roll up and you be like, hey, so, do you like cocoa? I mean, that's one of my lines. Anyway, when I used to be in the club scene, I had to retire, probably because that was one of my lines. Anyway, but it's a whole different ball game when you're online, right? There's no, if I ask a girl if she likes cocoa, what's she going to do? She might like it, she might not, but she have to look me in the face and be like, oh my God, did you just ask me if I like cocoa? And then she'll see me crying, and then she'll feel bad, and maybe she'll buy me a beer. Anything can happen. Hey, man, I'll tell you, try it. But in this instance, there are no consequences, right, Casey? They could just next you and keep it moving without ever saying a word.
Yeah, and the funny thing is you keep saying girls, and I wouldn't take much issue if it was just girls choosing not to talk to me, but it was 95% of people, and of that 95% of people, 71% of them were guys, and they nexted me just as quickly.
Oh, yeah, but Casey, didn't you have a friend of yours who's a woman also try the same thing?
Exactly. I mean, that's what I did. I wouldn't describe myself as grotesquely ugly, but I wouldn't say I'm the most handsome guy in the world.
Okay.
Yet there had to be some explanation for my 95% dismissal rate. So I brought in a girlfriend of mine who's really, really hot.
Okay.
And cute and sexy and all that. And I just wanted to see what it would be like with her on there. And the results were... They were unbelievable. It was the antithesis, the total opposite of what my experience was for her. I think it was something like 90% of guys, 90% of people, not guys, 90% of people chose to talk to her. Boys, girls,
Everyone wanted to talk
and then
to her.
that third category, they were all psyched to talk to her. And then the final test that I did, Derek, was I stuck my face in there, so it was her and I together, the two of us on there. And immediately that next button just started going one after another after another.
Casey,
so
Casey, you're a next magnet.
I'm just a next magnet. But yeah, the vast majority, they're just on there looking for pretty girls, and they don't want to talk to guys like us.
Interesting. Well, Casey, I want to thank you for calling in and breaking this down for us. For those who haven't checked it out, we're talking about chat roulette. Big ups, Casey, and congrats on your flick. Folks can check it out on our Facebook page, actually on my Twitter, twitter.com/Ashong. We have tweeted out a link to Casey's video. It is not for kids, mind you. It's not gross, but chat roulette is for adults. Thanks, Casey. I will give you guys my personal take on this. I love the concept of meeting and greeting people and finding folks across different kinds of cultures, et cetera, et cetera, et cetera. Chat roulette is tough because it means that you could skip over anyone, so you're not really forced to talk. I would love it if they would try a couple of things. One, make it so that you got to give the person at least 60 seconds before you can next them, right? You should at least find out, like, hey, who are you? Hey, I'm so-and-so. Oh, do you want to talk? Well, I don't know. Well, you seem pretty cool. Okay. Yo, I'm going to try to holler at somebody else. All right, it's been cool. Yo, real peace. Something so that it's not just the random, is she cute? Is she cute? Do I see boobs? Next. Then the second thing is, in order for something like this to work, you got to have some kind of controls. You got to have some kind of controls. I mean, honestly, I can't mess around on chat roulette because I don't want to see all them naked dudes. Not that I have anything against naked dudes. Once a day at least, I am also one, right? Hopefully, I get in the shower and I too am a naked dude, but I'm not naked for you. So, in a nutshell, chat roulette is interesting, but it's not that hot yet. We want to know what are the dopest technologies. Every week we're going to be trying to find out what is cool and hip in the social media world and how you can best connect with each other. That's what's up. Yo, we are going to take a quick break. And, we've got a couple of things coming on. We flipped the script from healthcare to chat roulette. Next thing, we're going to talk about the population and the census. You're listening to the Derrick Ashong Experience. We all over the map, baby. Worldwide, my kid. Topic to topic. We'll be right back.